Her platelet count was 39,000. A normal count for a woman about to undergo a cesarean section is between 150,000 and 400,000 per microliter. That number, 39,000, appeared in her medical file the morning of April 20th, 2020. The surgical team at Montefiore Medical Center in the Bronx proceeded. During the operation, Amber Isaac hemorrhaged on the operating table. She was 26 years old. She died that day. Her son, Elias Isaac Evans, was delivered alive. The platelet count that preceded that hemorrhage had not appeared without warning. It had been declining for weeks, documented across multiple appointments, noted by clinicians, and then used as no barrier to making the first incision. Amber Rose Isaac was 26 and lived in the Bronx. She was in the final weeks of her first pregnancy, receiving prenatal care through Vanderbilt Clinic, part of the Montefiore Medical Center system, a major New York hospital network with teaching affiliations and a mission to serve Bronx communities. She was not an unseen patient. She had scheduled visits, test results, and a relationship with providers in the system that was entrusted to keep her safe. She had shared her concerns openly, naming the hospital that would deliver her baby, and she had posted publicly about her fear. She was preparing to become a mother. Platelets are blood cells responsible for clotting. When counts fall below 100,000, clinicians flag the risk. Below 50,000, surgical procedures carry significantly elevated bleeding risk. Amber's count trended downward across documented prenatal visits. The trajectory was visible in her chart. The clinical implications of a low and falling platelet count in a patient approaching delivery are standard medical knowledge. Specialist consultation, monitoring, preparation for transfusion, and informed consent about elevated hemorrhage risk. Amber brought her numbers to her care team, raised the concern, and the decline was acknowledged in notes. The information was there. In the weeks before her death, Amber presented to labor and delivery at Montefiore twice. She reported symptoms and brought her blood work. Both times she was evaluated and discharged. A young woman in late pregnancy flagging a known deteriorating lab value. Presenting in person to the department responsible for delivering her child and each time sent back home. Standard obstetric protocols include escalation criteria and specialist involvement for platelet counts in her range. Whether those protocols were followed is central to the family's civil suit. What is undisputed is that she came twice and left twice. The night before her scheduled cesarean, Amber posted on social media. She wrote that her platelet count had been dropping for weeks, that she had gone to labor and delivery twice, and that staff had sent her home. She tagged the hospital and wrote, "Please, I am scared." That post was specific, named the institution, and time-stamped the night before her operation. She put her fear and her clinical data in writing, with her name attached, for anyone to see. The post survived her and became part of the public record of what happened. On April 20th, 2020, Amber was admitted for the scheduled cesarean. Morning blood testing confirmed a platelet count of approximately 39,000 per microliter. That level is not borderline. It places a patient in a category that in obstetric surgery guidelines requires clear precautions, hematology consultation, readiness for transfusion, explicit informed consent about hemorrhage risk, and in some guidelines, postponement of elective procedures until the count improves. The surgical team proceeded. During the cesarean, Amber experienced catastrophic hemorrhage that could not be controlled. She did not survive. Amber Isaac's death is part of a broader documented crisis. Black women in the United States die from pregnancy-related complications at 3 to 4 times the rate of white women. This disparity persists across socioeconomic status and access to care, and it has been analyzed in peer-reviewed research and reported by the CDC. Studies also demonstrate that Black patients' reported symptoms and pain are often taken less seriously in clinical settings. Amber had declining labs, repeat ER visits, and an explicit public plea the night before surgery. Her case fits a pattern documented in data and studies: clear signs, unmet escalation, tragic outcome. The aftermath was immediate and public. Amber's partner, Tony Evans Jr., posted about her death, listing the platelet count, the ER visits, and her social media plea. His account was shared millions of times, and the case became a focal point in national conversations about Black maternal mortality. Montefiore issued condolences and said it would review the case. The family filed a lawsuit in civil court. No criminal charges followed. No formal public finding of institutional negligence had been issued in the months after. The hospital continued to operate. Elias was left to grow up without his mother. Her death crystallized a statistic into a person and a timeline, a lab value, twice presented symptoms, a social media plea, and a surgical decision that ended in hemorrhage. It became a reference point in 2020's intensified public reckoning with systemic inequity in healthcare. The case contributed to pressure on institutions and state health authorities. New York State moved to require hospitals to report maternal mortality data disaggregated by race. Commitments and policy adjustments followed. Whether they closed the gap is still under measurement. Amber Isaac brought documentation, blood work, and fear to providers in person, and then publicly, the night before she died. The trajectory of her platelet count was recorded. The visits were recorded. The post was recorded. On the morning of April 20th, the number in her file was 39,000, a number no clinician encountering her record that day could reasonably claim was new. The surgical team decided to proceed. Amber hemorrhaged and did not survive. Elias survived. The record of what was known, when it was known, and what was done remains. Subscribe to Case Files TV because the failures that kill people are often quiet, documented, and preventable.